All of us. So our final piece this morning that I'm leading is the Corporate Spotlight. This is going to be an interactive session between two speakers, Dr. Mark Blatt of Intel and Dr. Ebenezer Appiah Denkyira of the Ghana Health Service. They're going to tell you a little bit more about themselves in this process, and they're going to have a conversation, but I'll just say to you that these are two men who are leading innovation and delivery of mHealth throughout the world. They're taking on some of the biggest issues around transport, infrastructure, delivering cost-effective health care in lots of different countries around the world. And I think you're going to find this a pretty exciting and interesting exercise to watch the two of them put their heads together in our Corporate Spotlight segment. Thank you.
Okay, I'm Dr. Mark Blatt, Intel's Worldwide Medical Director. Wanted to talk to you a little bit about mobile health and mobile technology. We've heard a lot about phones while we were at the event, and while phones are absolutely a fantastic way for delivering information and consuming information, wanted to talk to you a little bit about what the promise of mobile technology and mobile health might look like if we started to move beyond the phone. At Intel, when we start to look at mobile technology, we often start with the task that we're trying to accomplish. What am I trying to do when I go mobile? How can mobile technology enable me to do something differently? So I start with the task I'm trying to look at, and then I start to think of the right tool that helps with that. And one of the things we start to think about that we want to move towards is collaborative workflow. Mobile tools actually offer the promise of collaboration. I'm a family doctor by training in the U.S., and most of the time in the U.S. healthcare system, we work in fragmented data silos. You've heard a lot about that at the event. How can we use mobile tools to actually integrate care? We can start by consuming data. We can start by reviewing data. We can start by creating a little bit of data. But mobile tools offer us the opportunity to share data through a virtual system to providers and deliver care, education, training, analytics where it's necessary. Mobile tools offer the opportunity to do more than just look up data. While looking up data to make informed decisions is a great start, we can do more with mobile. We can do more with mobile technology than just look up data. Looking at how we educate our providers, how we deliver them interactive education, both in a pre-service level for training and actually continuing education when they're out in the field, interacting with them in an educational manner and offering teleservices, telemedicine services. The phone might not be the best technology for that. The phone might be the best technology for field-based diagnostics and field-based interactions. The phone might be a great technology, again, for presenting and consuming information. As I go mobile, though, I might want to work online and offline. Mobile tools are great when they're connected, and they're great when they're connected to networks, but they offer the power of bringing education to remote areas where you go online and offline. They offer the ability to do data analytics and improve decision support and education for remote providers on their own when they're in a disconnected manner. These are actual real pictures that we've done as we've gone through using mobile tools around the world to actually improve things. We're going to hear from Dr. Appiah about a school and a school-based interaction program that is running in Ghana to help improve pre-service education, and will move to ongoing education. But the ability for mobile healthcare workers to be informed, to better present information, to do population health surveys, to look for disease surveillance, to again do remote telemedicine consults. The ability to staff a clinic in a remote area. The picture in China is actually a rural clinic in the mountains of Hunan that I ended up visiting, and the doctor was using remote technology with an internet connection to actually deliver services in a one-room clinic. It improved his ability to be both educated, to make informed decisions, and actually to get paid better and quicker and on time. The ability to actually build virtual capacity in virtual hospitals. So maybe I want to spend a moment here on this concept. This is a developed world slide that I've often used to talk about how care should be integrated, how data should actually flow not just from the community hospital worker to the developed hospitals. And when we think of telemedicine, it's kind of like tertiary consults. But how can we go beyond that? How can we use these tools to empower citizens to better care for themselves so we diminish the pressure on the healthcare system where we have capacity problems in third world countries? How can we educate citizens to help care for themselves in an ongoing fashion? How could we work with emergency services, possibly where transportation is very difficult, to treat in place? So in many ways, mobile tools offer emerging economies the opportunity, pardon me, not to make the same mistakes that we've made in developing worlds in building our Western healthcare system. As we know, in most Western worlds, our healthcare system is completely unaffordable and is collapsing of its own weight at this point. I think in the emerging world, they have the opportunity, much like they kind of leapfrog from landlines to cell phones, they have the opportunity to think, how do I develop a virtual system where virtual care makes sense? It doesn't make sense everywhere. We need bricks and mortar facilities. But how do I pair virtual care with bricks and mortars in a grounds-up design? Not how do I introduce it and shoehorn it in as we're being forced to in the developing world, but how do I put this together in an ongoing fashion? How do I make a difference? How do I lower care, increase access, improve the quality of decision making? If I'm using mobile tools just to consume data, I'm not taking the full advantage of what mobile can do and mobile technology. I want to be able to empower citizens to work offline, online, to make decisions, that the information for the citizen is secure in a mobile device, even if that mobile device goes missing, which occasionally it will. So these are all theoretical considerations and theoretical ideas. What I'd like to do now is turn the podium over to Dr. Appiah and have him talk about an ongoing education program in Ghana and give you a real-world experience.
Thank you. Thank you very much, Mark. This is Ghana, and Ghana has a population of 24 million, and it's in the western part of West Africa, in Africa. It has the size of Great Britain. In the early 90s, we lost a lot of staff through brain drain, doctors, nurses, health personnel, and in making up, we had to establish more schools, expand the old ones. So the schools increased from 19 to 90 in 7 years. Now I have 25,000 students and high enrollment. But all these are at a cost, because the infrastructure was challenged. We had books problems, we had staff problems, and the students' motivation was low. Academic performance slumped to about 50%. So a quick assessment revealed that the gap was actually technology, and that is how we came to mobile phone. So we entered a public-private partnership with UNFPA, with Intel and Japago. The idea is to standardize contents across board, develop content so that all the schools can use, and then make get affordable mobile phones, equipment, or tablets, netbooks, so that the students can purchase from their scholarships. An Intel school has provided a platform for which we can use. The device, we chose netbooks instead of mobile because of the cost effectiveness of it, and it also enables knowledge creation than consumption. So far, 10,000 netbooks will be distributed in December to all the schools, and the e-learning platform and content creation will be implemented over 2 years. I was the director of the human resource, but I moved to the Ghana Health Service as the Director General, and I intend taking along with me the mobile phone. This time around, we'll use it in training, in-service training of over 50,000 people, and that is why I'm here today. So you hear about that maybe during the discussions with Mark. Thank you very much.
Dr. Appiah, you described a program where you're using mobile devices to provide in-service education for citizens right now, for educators, for students in your country. You described where phones might come in. Take me out about 5 years. Take me out for what your vision of how mobile technology actually will help transform the Ghana Health Service over that period of time.
Well, that's a good question. I expect that in 5 years' time, all people living in Ghana may be using mobile phones somehow in transmitting health information either to colleagues or to patients in the home. For the health sector, we use it in helping patients, reminding them of the time they should take their medication, and especially the pregnant women reporting to the clinic. We also use it in referral. In Ghana, we have a system where we have the community health nurses in the community. Then at the higher level, we have the field physician assistants, then the doctors. So in referral and helping the diagnosis, you can also use the mobile phone in doing all those kind of things. For the netbooks, we need it for more complex activities. For example, the training. We expect that we could use it in expanding the number of students that we take and also providing quality in terms of uniformity when it comes to the contents. We also use it in in-service training. I was talking about 50,000 workforce, and we expect that instead of them moving to the center always for training, we will now send the training to them in the periphery. We could also use it in handling commodities. Usually we run stockouts in the deprived areas. And it should be possible that at the center we'll be able to identify those who need logistics so that they can be supplied to them. We also use it in collecting data, service data, human resource data, financial data. So we can use it for a lot of things in Ghana, and I expect that in 5 years' time a lot of things will change.
So it seems that you're already expressing that initial thought that I kind of ventured, the right tool for the right task.
Exactly.
Certain devices with larger real estate seem to help better with consumption of data to do the training activities, whereas tracking materials, the commodities, the phone might be the ideal tool for something of that nature. Yes. Going forward. Well, you know, this vision sounds absolutely fantastic going forward, empowering people with the data and the mobile devices. But how do you get started? What do you do next to get on that journey?
Well, I took over as the Director General of the Ghana Health Service barely a month ago. And the first thing I did was to bring together all the pilot things that we've been doing. And the idea is to form a committee and then brainstorm on the way forward, which ones are we supposed to scale up. And obviously, we need a private sector participation. So we invite the private sector to support us in developing the programs. And Ghana, we have a nice policy on PPP as well as ICT application.
So how do you get started with these public-private partnerships? Are there any concerns? Are there any issues that you start to face going forward?
Yeah, we will certainly lack. We're challenged with capacity. So we need training, capacity building, and we also need the devices. We need large numbers of devices for students, for health workers. I'm talking about 90,000 people, including the private sector as well. And we need a capacity management of the whole program. So it's just a matter of capacity building.
So 90,000 people with mobile devices of various sorts doing different tasks and interacting together in this environment. The issues around building the partnerships, and how do you reach out, or what do you do to organize them? Have you created policies or activities in Ghana that enable that to start to move forward?
Yes, we have the private-public partnership policy driven by the Ministry of Finance and Economic Planning. And then we have a policy on ICT, so that anytime anybody wants to apply something, you have to get to the Ministry of Finance for them to support you. So we have the enabling environment.
And you mentioned the funding. How do you reach out for the funding, or what do you do to actually attract the dollars to Ghana, the resources as you describe that?
Well, in the private sector, I think after you've listened to us, looking at the number of people that we are talking about, I tell you that Ghana, we have an enabling environment to attract you. Even though our elections are coming on very soon, I promise you that there will not be any change. Whoever wins, there will be an enabling environment for us to proceed with what we want to do.
So a framework has been developed,
yes.
Policies have been put in place,
yes.
to attract the investment dollars. There's a stable political system despite changes in democratic elections, and the country is moving forward with a cohesive strategy, yes. for delivering mobile technology to improve the healthcare system.
Precisely.
Brilliant. Well, you have a great audience here, some people that might want to do public-private partnerships with you. What would you like to ask them to do to you and to help Ghana with?
That's a good question. I wish to invite all of you to invest in Ghana. We have over 90,000 people waiting for health professionals. We have over 2,000 health facilities and about 20% more in the private sector. And we have 24 million people. Ghana, everybody is hungry for mobile technology. And I wish to invite you to invest. And I tell you that there will not be any failure or maybe any change in policy should any government come to power. So you're all invited to Ghana, and I appeal to you that you help us to improve the lot of our people, especially when it comes to development, training, when it comes to consumables management, when it comes to infrastructure for ICT. So you are all welcome to Ghana, and I hope that you invest in Ghana. Thank you very much.
That sounds like a wonderful vision, and if you come, I bet you get dinner out of it as well.
Yes.
This actually is a wonderful idea here. This is what we're talking about with using mobile tools to actually transform a healthcare system, putting policies in place, putting activities in place, driving the public-private partnerships, looking at the task-based activities that the mobile tools can help drive, using them appropriately for education, for diagnostics, for analytics, for training. The plethora of things that mobile tools can do to transform a healthcare system in Ghana is Dr. Appiah's vision. I think you're all welcome to contribute, and that's what he's asking for. We need to use our imagination and innovation to let mobile transform healthcare. We shouldn't be stuck in the paradigms that we're initially developing. We should let our imaginations free and allow mobile technology to truly transform the healthcare systems of the future. Well, thank you for letting us share this vision with you for a few minutes. Thank you very much.
Thank you.